Sudden cardiac arrest is a condition when the heart suddenly and unexpectedly stops beating. Needless to say, time is of the essence for the patient. And to tell us more about the condition and how to fight it is Dr. Martin Klosterman of Boca Raton Regional Hospital. First of all, doctor, thank you for joining us.
Thank you.
Well, let's talk about, first of all, what is sudden cardiac arrest?
Sudden cardiac arrest is a cardiac condition where the heart unexpectedly starts going from a rhythmic contraction to a quivering of the chamber, which prevents blood circulation from continue to happen.
Okay, and what causes this, first of all?
This is an arrhythmia that is caused sometimes by a structural problem of the heart muscle and sometimes is linked to another common situation which is called, in layman terms, heart attack. The heart attack is a plumbing problem where one of the main vessels of the heart can be obstructed and therefore part of the muscle doesn't receive the oxygenated blood needed. Now this can lead in turn to an electrical condition that again renders the muscle ineffective about propulsing the blood flow.
Gotcha. So the quivering versus just the stopping.
And the quivering needs to be immediately reversed to normal. And there is a time window where it's very important to get to.
Time is of the essence. So first of all, what can be done to treat? Are there any definitive treatments for cardiac arrest?
Well, the problem with cardiac arrest is the challenge of not knowing who is going to be the next victim. So it's important to define the risk of people for cardiac arrest and then act as what we call primary prevention, that is being proactive. In this regard, we research to these devices called defibrillators or implantable defibrillators, which are little machines that will constantly monitor the heart rhythm, and if one were to develop this electrical abnormal activity, the device will automatically recognize it and deliver a shock that will reset the heart back to normal. This would be instead of what viewers might be more familiar with, the rushing into an emergency room with people thumping in your chest and eventually have these paddles to convert you back to heart rhythm.
And quickly, last question, maybe there's somebody out there who thinks they might be at risk. Is there any test you can take to see if you really are at risk for sudden cardiac arrest?
Today, the most important marker we have about predicting a victim of possible cardiac arrest is the measurement of what we call ejection fraction, and that in layman terms is the ability of knowing what is the heart strength. If the heart strength were to be equal or less than half normal for whatever reason, what is heart disease in terms of coronary disease or high blood pressure or heart failure, this will be a marker of a need of further intervention.
Okay, thank you, Dr. Klosterman. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.